We bruise because it's a part of healing, and actually stem cell therapy is created from bruising. It's from our platelets. So our platelets, or platelet-rich fibrin, is what we use actually to improve collagen and results overall. So healing within is platelet-rich fibrin. Now we try to prevent bruising with certain procedures such as filler and injectables. But as you can see here, there are many vessels throughout the face. And so even in the best of providers, up to 70% of people can bruise with an injectable. Anything that you place a needle into with this type of structure is going to have a risk of bruising. As you can see, there's many arteries on the face as well. So many times when your provider will tell you, no, that's not a good area to inject, we tell you that for a reason, for your safety. We also provide you with bruising prevention protocol, and this goes over several things that can affect the outcomes and help prevent bruising. I will say though that even with people that we give these instructions to, there's still a likelihood to bruise because again, you're injecting into a structure that has many vascular objects around it. Things that affect bruising overall include alcohol. Alcohol can prolong your bleeding time, what we call your pro time. NSAIDs, Motrin, ibuprofen can increase your platelets to actually aggregate and to clot. And we also have patches that are called Ocumen. Now these patches are just recently out, but I found these when I taught in Beverly Hills with Dr. Kian Karimi and Dr. Anil Rajani. They actually technologies in the patch, but it's arnica that is delivered through a patch, a state-of-the-art system. So we have those available for purchase. When I teach, we always say you bruise them, you lose them, but the truth of it is, it's just part of it. It's part of healing. So make your appointment where you're not having a date the next day or a wedding the next day, and add in factors to heal. And just know that you're in a very safe place. We also, have several years of, decades actually, of knowledge to keep you safe and healthy here. If you start to see bruising, we keep our patients post-injection time about 10 to 15 minutes, and so that we can make sure you're safe. We also have Ocumen patches, as I talked about. We have topical arnica and oral arnica. Bromelain is readily available at the grocery store because pineapple, fresh pineapple, that center core, has the most bromelain that will help with healing and inflammation. On that note, it's important to know that some of the procedures we want inflammation, so make sure you talk to your medical provider prior to starting or stopping these medications. And also if you have any history of blood disorders or bleeding disorders, let your provider know as well. It is important to call your provider when you have any questions at all. If you have a bruise and you're concerned, call us. We're concerned if you're concerned.